Folks, we are live from ASH 2018. We're one of the big brains in blood cancer. Dr. Tanya Siddiqi from City of Hope has just given a talk on CLL. Good morning, Dr. Siddiqi. So now, those of us on Facebook are not physicians. Your talk was fascinating and well attended, but could you tell us essentially what you were talking about for a layman's audience?
Sure. So I was talking about a disease called CLL, chronic lymphocytic leukemia, and there's a lot of good data and research currently ongoing in this disease for patients, especially with relapsed disease. There are a lot of novel agents out there that are oral, and there are different combinations that are being tested and being presented here at ASH with a lot of good data. And my research right now that I presented has to do with CAR T-cell therapy, which is a form of gene therapy.
Yeah, could you talk a little bit about what CAR T-cell therapy is for those?
Sure. So CAR T-cells is where we take patients' own immune cells and train them to, instead of looking for infection to fight infection, to instead look for their lymphoma and fight their lymphoma when we give it back to them. And of course there are many nuances, and there are many different products by different companies, different medical centers. Even City of Hope has its own product, for instance. The one that I talked about is by a company called Juno Therapeutics, or Celgene, and they, the CAR T-cell that we use is the same one that we've used for different lymphoma as well, and that was presented last year with some excellent results and less toxicity than maybe other CAR T-cell products. In CLL, CAR T-cell research is just sort of taking off, and we've heard about 3 different talks today alone of CAR T-cells in CLL. Some combining with an oral agent called ibrutinib to see if results could be even better. My study that I presented is just Juno CAR T-cells on their own for patients with very refractory or very multiply relapsed CLL patients, especially after they failed the standard ibrutinib therapy, which is one of the best treatments for CLL out there. So patients who relapse after that really have limited options and poor prognosis, and unfortunately can die very quickly unless we salvage them. And CAR T-cells may be a really good way to do that. What we showed was that in 16 patients that are evaluable thus far, these Juno CAR T-cells has given a best overall response of 81%, which is very high. And most of these were already in remission, whether CR or PR, meaning complete or partial remissions, at their day 30 assessment, meaning just 1 month after CAR T-cells. And there's a special test called minimal residual disease testing that we do to detect whether our human test can even detect very, very low levels of CLL cells in the blood or the bone marrow. And by that testing, 73% patients were negative for CLL at their day 30 assessment, and this was maintained at month 3 and month 6 for the patients who've been evaluated that far. Follow-up is still early. We need to have we need to still follow these patients over time to see how they do over the next few months and years, obviously. But our hope is that once they have achieved an undetectable MRD status, that they'll remain in a complete remission forever, hopefully, without needing any further therapy.
Exciting stuff, Dr. Tanya Siddiqi from City of Hope. Keep it tuned all weekend long right here to Facebook for more from our City of Hope doctors.